Hi, my name is Lacey Schooley, and today I'm going to be demonstrating range of motion on a patient and repositioning a patient in bed. So before I enter the patient's room, I'm going to check their chart and make sure it is okay to do range of motion with them. It is, so I'm going to enter the patient's room. Phone hand hygiene. Hi, my name is Lacey. I'm going to be your nurse today, okay? We're going to do some range of motion. Perfect. So to start, I'm going to raise the bed to waist level. Perfect. So let's start by okay, so we're going to start range of motion on your arm, okay? So I'm just going to expose the arm that I need. So in an actual scenario, I'd be performing each exercise on both arms 5 to 10 times, but for the video, I'm just going to do one side of the body 2 times. So let me know if you have any pain or discomfort with any of these exercises, okay? I'm going to start with extension. I'm going to hold the bottom and the top of the arm, supporting all of the joints. Bring the elbow to the ear, making sure not to go past the point of resistance. Okay, now we're going to do abduction and adduction. So I'm going to bring your arm out, and there's the resistance there, so I'm going to stop, and then adduction. Make sure that the arm goes across the midline. Again, I'm just going to do this twice, and then we're going to do external and internal rotation. So for this, normally the patient would bend their arm at the elbow and bring their arm across their body and touch the opposite shoulder. This patient's arm doesn't bend, so I'm just going to pretend. Okay. So that's it for the arm exercises. If this were a normal bed, I'd put the rail up that just goes right here. So now we're going to go onto your foot, okay? Again, let me know if you have any pain or discomfort. So I'm going to start by supporting under the leg, bringing it up, keeping it straight, and then bending it at a 90-degree angle. Okay. And then again, abduction and adduction. Again, supporting the joints, and there's some resistance there, so I'm going to stop, and then you would bring it across the midline. Do that twice. In a normal situation, I would do that 5 to 10 times. And now we're going to do external and internal rotation. So to do this, I'm going to keep the patient's legs straight and rotate the big great toe in. Okay. And then with the lesser toe, keeping the legs straight, bring it out, back to neutral. Perfect. Okay. So when I'm done with all of the exercises, I notice that my patient is low in the bed, so I'm going to get an assistant and we're going to move you up, okay? So to start this, I'm going to take the pillow out from your head and put it on the headboard. Okay. We're going to grab this draw sheet and roll it up against you, grabbing at the shoulder and the hip of the patient. So what I'm going to have you do is bend your legs at the knee. So this puts the patient's feet flat on the bed, which allows them to push off as we're moving them up. Okay, so on the count of 3, we're going to push you up in the bed. So I'm going to have you push off with your feet and flex your necks forward, okay? Okay, so my front foot is facing towards the top of the bed, and then my back foot is facing towards the bed. So on the count of 3, 1, 2, 3. Perfect. Place the patient's head under the pillow. Awesome. Okay, so after the patient is in this position for 2 hours, we're going to rotate into the lateral position. So with the assistance of my fellow nurse, again, she's going to help me roll the patient onto his side. So to do this, I'm going to have you bend your knee and then bring his arm across his chest, and she'll grab 1, 2, 3. Okay, and then I place pillow under the patient's back. Okay, and roll him down, and then place the pillow between his knees and ankles, which provides support and takes the compression off. And then I'm going to roll his front shoulder forward so there's no compressing of the nerves or anything like that. So then after 2 hours, we're going to put the patient back in supine position. So again, with the help of my nurse, we're going to roll in 1, 2, 3. Take the pillow out from under him, laying back down. And then I'm going to reposition this pillow between his legs to under his knees. So this just takes the pressure off. If my patient were unconscious, I would put the pillow, another pillow under his ankles, so that way there's no pressure sores or anything like that. And I'm also going to place a pillow under the patient's forearm. Okay. In a normal scenario, I'd place a pillow under both forearms, but for the video, I only have 2 pillows. So then, after I come back in 2 hours to reposition the patient, he would be like this in supine. Take the pillow out. I'm going to get his blood pressure, and then I'm going to put him into high Fowler's so that we can get him up to ambulate. So, to do this, put the bed rail down. Okay. I'm going to leave the pillow under his knees just for a little more comfort as I'm raising the bed. I'm going to put them in high Fowler's, they're 60 to 90 degrees. And then at this point, I would put the gait belt on the patient and get ready to turn him so he can dangle off the side of the bed. For this part of the demonstration, I'm going to use an actual patient. So I'm just going to scoot him over, making a little room on the bed. Okay. So So the gait belt is on. Okay, so put the gait belt on. Make sure that I can get 3 fingers in there. So after I get the patient up like this, I'm going to lower the bed so that way her feet are on the floor. Again, get the blood pressure of the patient. Ask her if she's experienced any dizziness, nausea, or anything. Nope. Okay. If she was, we'd lay her back down in the bed. So at this point, I'm going to make sure she has a robe on and non-slip socks, or in this case, she has shoes on. So I'm going to line my feet up in her knees, and then you can grab the top of my shoulders, and we're going to stand up on 3, okay? 1, 2, 3. I'm just going to shuffle to the back of the wheelchair. Okay, and then you can reach down and lower yourself. Okay, so before bringing the patient to the wheelchair, I made sure it was locked and that the foot pedestals were out of the way. The patient's back is against the back, body's in good alignment. So how's that feel? Good, good. You want to get up and go for a little walk? Sure. Perfect. So we're going to do the same thing. Align my feet. So you can either grab my arms or you can push up off the chair, and then on 3 we're going to stand up, okay? So 1, 2, 3. Okay. Then I'm going to come around the patient, walking slightly behind them. I'm just going to go to the door, and then we'll turn around and go back to bed, okay? Okay. So I'm going to have the patient sit in bed. Take the gate belt off. Okay. Okay. Yeah. Okay, so at this point, the doctor has ordered compression socks for the patient, knee-high length. So in order to get the correct size, I'm going to measure from the bottom of the heel to 1 inch below the knee, which is 15 inches, and then around the thickest part of the calf, okay, which is again 15 inches. So after grabbing the correct size, going to place my arm inside the compression sock, grab the heel. Okay. Okay, these are going to be tight as I'm putting them on, okay? Okay. then I'm pulling them up. I'm gonna make sure to get all the wrinkles out. And then if this were the correct size, it would stop 1 inch below the knee. Perfect. So it's wrinkle free. I'm gonna make sure the opening is at the bottom so that way you can easily check the circulation of the foot. So then after I have both compression socks on, I'm done. So is there anything else you need before I leave? Yep. Perfect. So I'm gonna perform hand hygiene, exit the room, and then document everything we did.